Do you want to learn how to last longer in bed? Well, I'm Dr. Rena, a urologist and pelvic physician, and today I'm going to answer that exact question. Before we begin, let's first understand how long people usually last in bed, what's considered average. If you've seen my previous video about the typical duration of sex, you may remember that the average time from the start of vaginal penetration to the finish is around 5.7 minutes. That's the average. So if that's where you are and you feel comfortable, that's completely okay. However, when people are surveyed about how long they would prefer sex to last, most say somewhere between 7 to 13 minutes. Today, we're going to discuss how to manage something called premature ejaculation, which can help you last longer in bed. But before you go down this path or even continue watching, make sure this is something both you and your partner actually want. If you're both satisfied with how long sex lasts, there's no need to change anything. It's also important to talk with your partner about the kind of stimulation they enjoy. It might not be only about penetrative sex. Perhaps they prefer oral, manual stimulation, or even incorporating intimacy tools. So, have that conversation and explore other ways that might be just as pleasurable or even more enjoyable than simply extending penetration time. So, when should you think about using the methods in this video? In medical terms, when ejaculation happens sooner than you or your partner would like, it's called premature ejaculation. Research shows that about 30% of men experience this, but only around 9% actually consult a doctor about it. So, how do we define premature ejaculation? There are three main factors. First, ejaculation occurs within 1 to 2 minutes of penetrative sex. Second, there's an inability to delay ejaculation in nearly all sexual situations. And third, it leads to negative personal effects, such as frustration, stress, or anxiety. If these symptoms are truly causing you distress, that's considered primary premature ejaculation, meaning it has been present throughout your life. Sometimes, people develop what's known as secondary or acquired premature ejaculation. This happens when you previously had normal ejaculatory function, meaning sex lasted a typical amount of time. And then suddenly, you begin experiencing a shorter time to ejaculation, often less than 3 minutes after vaginal penetration. This change tends to persist over time, causes concern, and is noticeably different from how things used to be before. There is evidence suggesting that this may be linked to irregular signaling of a brain chemical called serotonin. In individuals with premature ejaculation, certain receptors that respond to serotonin, which normally help delay or prevent ejaculation, don't function as effectively. It's also helpful to understand how ejaculation works. It's actually a reflex, meaning your body automatically responds to specific triggers. In this case, it's usually friction, along with how your brain interprets that sensation as pleasurable. This reflex is controlled by an area in the spinal cord known as the spinal ejaculation center. When stimulation occurs, signals are sent to this center, which then combines that input with information from the brain, such as your thoughts and perceptions, and activates the ejaculatory response. At its core, premature ejaculation can be very stressful. Studies show that many men try 5 or more different approaches before finally consulting a doctor about it. But when you do visit your doctor, you might wonder, are there specific tests they will perform? The answer is, there actually are. There's actually no specific diagnostic test required to identify premature ejaculation. It's what we call a clinical diagnosis, meaning your doctor will talk with you about what has changed in your ejaculation, or how it has always been, and try to understand your experience. If it fits the pattern of happening sooner than desired and is causing you concern or distress, that's usually enough to move forward with treatment. So, what treatment options are available? The first approach is psychotherapy or sex therapy. This is important because factors like depression, stress, anxiety, or even guilt can significantly affect how quickly ejaculation occurs. It's essential to consider how your mind is processing sexual activity with your partner. Addressing these concerns with a trained psychotherapist or sex therapist can make a meaningful difference. As always, I'll include a resource to help you find a qualified sex therapist near you. Studies show that individuals who combine therapy with other treatments can increase their time to ejaculation by up to 8 times. Another option is known as the stop-start technique. With this method, when you feel close to ejaculation, your partner gently squeezes the penis until the erection partially subsides. This is repeated about 3 times before allowing ejaculation to occur. Practicing this regularly, around 3 times a week, can gradually help you extend the time before ejaculation. In some cases, working with a pelvic floor physical therapist alongside practicing these techniques at home can be even more beneficial. They can help you recognize and strengthen the muscles that may play a role in controlling ejaculation. When it comes to medical treatments, the first-line option is topical anesthetics. These are numbing agents applied to the penis, and they work by reducing sensitivity in the head of the penis. As a result, less sensory information is sent to the spinal ejaculation center, which can help delay ejaculation, and in doing so, it helps prevent that reflex from being triggered. The first option when it comes to topical anesthetics is delay sprays. These are especially convenient because you can purchase them over the counter without a prescription. One product I often recommend is Premature. It's the only delay spray in the United States available without a prescription that has been clinically studied, so it's easily accessible. Their research was led by Dr. Kristen Mark, and the study protocol was approved by the Institutional Review Board at University of Kentucky. In this study, 195 men were recruited through a large network of individuals interested in improving sexual performance. Out of those, 91 men received a sample of the product and were instructed to use it every other time they had sex. They were also asked to complete a daily electronic survey. Before starting the study, participants answered several questions about their usual time to ejaculation, along with standardized questionnaires commonly used in research to assess premature ejaculation. One key question was, how much time typically passes between the start of penetration and ejaculation? At the beginning of the study, participants reported an average time of about 6.5 minutes. After using the product, that average increased to approximately 11.5 minutes, showing a clear improvement in duration. Interestingly, the researchers also looked at orgasm rates. They found that the percentage of both partners reaching orgasm increased from 44% to 66% after using the product. It's also very simple to use. The spray comes with a metered dose system, which means each spray delivers a consistent amount every time. You typically begin with 3 sprays applied to the head of the penis at least 5 minutes before sex. From there, you can adjust the dose anywhere between 1 to 10 sprays per session until you find what works best for you. The formula uses a proprietary target zone delivery system designed to optimize absorption while maintaining effectiveness. So what does that actually mean? In simple terms, it uses something called a eutectic spray. This means 2 different ingredients are combined to create an oily mixture. On their own, these ingredients don't require any additional liquid, or what we call a solvent, to dissolve them. As a result, each spray delivers a higher concentration and begins working more quickly. That's why you can apply it as little as 5 minutes before sex, and there's no need to wash it off since it absorbs so fast. Of course, if you're planning on oral sex, it's best to wash it off beforehand. Another advantage is that there's very little risk of it transferring to your partner, so they're unlikely to experience any numbness after use. Promescent has patented this technology, making it one of the top options available today. If you're thinking about trying it, you can visit their website and use the code RENA to get 15% off your entire purchase. They offer a wide range of sexual wellness products, not just for you, but for your partner as well, including condoms, lubricants, and more. Orders over $10 within the United States qualify for free shipping, and everything arrives in discreet packaging, so your privacy is maintained. Your purchase is also protected by a 60-day money-back guarantee. If you try it and aren't satisfied, you can get a full refund. There are other topical anesthetics available too, especially with a prescription. In the United States, one option is EMLA cream, while in Europe, Forticin is available. EMLA is considered an off-label treatment, meaning it's not officially approved for premature ejaculation. It contains 2 numbing agents, is applied about 20 minutes before sex, and needs to be washed off prior to activity. Possible side effects include penile numbness and, in some cases, mild irritation. For those in Europe, Forticin is actually approved by the European Medicines Agency for treating premature ejaculation. It also contains 2 numbing ingredients and is formulated as a eutectic spray specifically designed for this condition. Because of that, it also works quickly and can be used within about 5 minutes before sex. However, this option does require a prescription from a doctor. Moving on to the next treatment option, antidepressant medications. You might be wondering why antidepressants are used for this. The reason is that they affect serotonin levels by preventing its reabsorption, allowing more of it to remain active. This helps those receptors function better, which can delay ejaculation. Certain antidepressants, known as selective serotonin reuptake inhibitors, or SSRIs, are taken daily. These commonly include fluoxetine, paroxetine, and sertraline. Doctors prescribe these off-label, meaning they're not specifically approved for premature ejaculation, but one of their known side effects is delaying ejaculation. When taken daily, it usually takes about 5 to 10 days after starting the medication to notice any change, and improvement may continue over the next 2 to 3 weeks. Typically, treatment begins with a low dose, which is gradually increased as needed. Some common side effects include fatigue, increased yawning, nausea, diarrhea, and possibly increased sweating. One of the more concerning side effects is a reduced sex drive, which can be frustrating if your goal is to improve sexual performance. These side effects often appear early and may fade within 2 to 3 weeks, but there's still something to be aware of. There are also medications you can take on demand, meaning shortly before sexual activity. One example is clomipramine. This medication works by blocking the reuptake of serotonin, as well as another brain chemical called norepinephrine. It's typically taken about 2 to 6 hours before sex and has been shown to significantly increase the time before ejaculation. Its side effects are similar to SSRIs, so you'll want to watch for those. Another option is duloxetine, which is not available in the United States, but is used in Europe and other parts of the world. This medication acts more quickly, so it can be taken closer to the time of sexual activity without needing several hours of advanced timing. However, many people do become frustrated when using these medications. They may feel that the results aren't as effective as they expected, or that the cost is too high, or simply that they don't like the idea of needing medication at all. I will say, if you're dealing with erectile dysfunction, meaning difficulty getting or maintaining an erection firm enough for penetration, you should address that first with medications like sildenafil or tadalafil. You can also check out my video where I explain these options in more detail. In many cases, treating erectile dysfunction can also improve premature ejaculation. There are also 2 additional off-label treatments sometimes used for premature ejaculation. The first is tramadol, which is typically prescribed for pain relief. One of the ways it works is by mildly blocking the reuptake of serotonin. It's taken on demand, usually 1 to 2 hours before sex, in doses ranging from 20 to 100 milligrams. While some studies suggest it can increase the time before ejaculation, the quality of that research is limited. It's also important to be aware of possible side effects, including fatigue, nausea, vomiting, dizziness, headaches, and a small risk of dependence since it is a pain medication. The second off-label option is a class of drugs known as alpha blockers, which are taken daily. These are typically used to treat an enlarged prostate. Examples include tamsulosin and silodosin. They work by relaxing the prostate and surrounding muscles to improve urine flow. In studies, silodosin appeared to be the most effective among this group, although research is still limited. A common side effect of these medications is something called retrograde ejaculation, where semen flows backward into the bladder, leading to a noticeable decrease in ejaculatory volume. I hope you found this video helpful. As always, remember to take care of yourself, because you matter.